This is a PowerPoint presentation on ransomware by Amy Popa for Nursing 360, Professor Barker. Exchanging information across the healthcare system and achieving interoperability are goals and challenges healthcare organizations share. While healthcare's transition to electronic medical records brings efficiencies and benefits to care coordination, it also presents new challenges and risks in managing and protecting patients' medical identities. Ransomware is typically spread through fake emails that have been designed by the hacker to appear legitimate. These emails contain a link or attachment that contains macros. Once a link is clicked or a document is opened, the malware is downloaded and infects the machine quickly. During this time, the malware searches the hard drive, network files, external drives, and cloud drives for all the data that can be encrypted. Ransomware exploits system vulnerabilities to spread out rapidly, affecting as many devices or machines as possible. After encryption, an electronic key is required to unlock the files. The victim then pays a ransom to obtain the key to unlock their files. In comparison to other industries, such as financial services or retail, healthcare lacks sophisticated data security tools, making it an easier target with more lucrative data. According to the Federal Bureau of Investigation, medical identities are valued at 20 to 50 times more than financial identities, and criminal attacks are now the leading cause of healthcare breaches. A credit card is only good until it expires or is reported stolen. Medical profiles, on the other hand, can contain social security numbers, addresses, dates of birth, familial relationships, and medical histories. These can then be used to create false identities and lines of credit. According to the Department of Health and Human Services, close to 2,000 hospital data breaches were reported between 2009 and 2016. A 2016 attack on MedStar Health, a hospital system with a workforce of 30,000 employees that treats hundreds of thousands of patients in the Baltimore, Washington area, is emblematic of the threat. Physicians and nurses tried to access patient records, and a pop-up window informed them that they would need to pay $19,000 in bitcoins, which is a hard-to-trace internet currency, for a decryption key if operations were to resume at the hospital. At that point, caregivers could no longer edit patient records or access email or computer records that had to rely on paper records. They worried that these paper records would be missing vital pieces of patient information, complete medical histories, prescribed medications, medication allergies, and treatment plans. The attack also delayed reporting of laboratory test results, which prompted MedStar Health to divert ambulances to other facilities and cancel scheduled patient appointments. Because of security flaws in medical devices, the U.S. Department of Homeland Security actively investigates implantable medical devices that are subject to tampering. For example, researchers in 2013 demonstrated that wireless insulin pumps could be tricked into delivering a lethal dose of insulin. Researchers also showed how hackers could take control of wireless pacemakers and get them to deliver a deadly shock. This led doctors to disable the wireless functionality of former Vice President Dick Cheney's pacemaker. There are 4 risk categories associated with ransomware attacks. The first is medical malpractice. If patient care is affected or if the patient is harmed as a result of ransomware, there is the risk of medical malpractice. For example, if a medication error affected a patient when the computer pharmacy order entry was down, it could be considered malpractice. The second threat is the risk of patient and data privacy loss, which could lead to a Health Insurance Portability and Accountability Act, or HIPAA violation. Perpetrators of ransomware attacks can acquire patients' protected health-related information and engage in identity theft or blackmail. The third is property and reputation. The risk of reputation loss and the loss of future business is a serious threat to the institution. In 2011, a study examined 49 companies in the United States found that organizations averaged more than $3 million in losses related to reputation loss, abnormal turnover of customers, increased customer acquisition activities, and diminished goodwill. The fourth risk is cost and expenses. In 2016, the average total cost of a data breach was $3.62 million. This number varies on the size of the organization and the number of patients affected. Ransomware attacks against healthcare institutions have far-reaching implications. The vulnerabilities of healthcare technology are costly in both monetary value and patient safety. Patient identity, data, and safety are compromised during ransomware attacks. The institution's reputation is tarnished. Healthcare systems need to be proactive in creating a culture of security and vigilance when it comes to patient safety and data security.